Today, we're talking about Oxybutynin Chloride Gel in packet. This medication is used to treat an overactive bladder. It works by relaxing the muscles in the bladder, which helps to reduce leaking of urine, feelings of needing to urinate right away, and frequent trips to the bathroom. It belongs to the class of drugs known as antispasmodics. The recommended daily dosage and the best time to take this medication will depend on your individual condition, so be sure to follow your doctor's instructions carefully. Before using oxybutynin gel, make sure to wash your hands and the area where you will apply the gel. Then, gently rub the gel onto your skin as directed by your doctor. It's important to avoid getting the gel in your eyes, nose, or mouth, and to wash your hands after applying it. Make sure to apply the gel to a different area of skin each time to reduce skin reactions. After applying the gel, allow it to dry completely before getting dressed and cover the area to prevent the medication from spreading through skin contact. Wait at least 1 hour before exercising, bathing, showering, or swimming, to ensure that the medication is fully absorbed. It's also important to avoid smoking and open flame until the gel has dried. Use this medication regularly at the same time each day to get the most benefit from it. And don't forget to tell your doctor if your condition persists or worsens. Some common side effects of oxybutynin chloride gel in packet are skin redness, itching, swelling, dry mouth, constipation, dizziness, drowsiness, or blurred vision. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. To prevent constipation, consume dietary fiber, drink enough water, and exercise. You may also need to take a laxative. Ask your pharmacist which type of laxative is right for you. It's important to remember that this medication has been prescribed because your doctor has determined that the benefit to you is greater than the risk of side effects. Many people using this medication do not experience serious side effects. Contact your doctor immediately if you experience any serious side effects, including difficulty urinating, signs of kidney infection, mental/mood changes, or signs of stomach/intestinal blockage. A serious allergic reaction to this drug is rare, but seek medical help right away if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed here, contact your doctor or pharmacist. Before using oxybutynin, make sure to let your doctor or pharmacist know if you are allergic to it or if you have any other allergies. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's important to talk to your pharmacist for more details. Before using this medication, it's important to inform your doctor or pharmacist about your medical history, especially if you have conditions such as blockage/slowed movement of the stomach/intestines, stomach/intestinal disease, problems emptying your bladder, certain eye problems, liver disease, kidney disease, certain muscle disease, Parkinson's disease, or a certain nervous system disorder. This medication may cause dizziness, drowsiness, or blurred vision. It's important to avoid alcohol or marijuana, as they can make these side effects worse. It's best to avoid driving, using machinery, or doing anything that requires alertness or clear vision until you can do so safely. It's also important to limit alcoholic beverages and talk to your doctor if you are using marijuana. Before having surgery, be sure to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. It's important to be cautious in hot weather, saunas, or during exercise or other strenuous activities, as this medication can cause decreased sweating and may lead to heatstroke. Older adults may be more sensitive to the side effects of this drug, especially drowsiness, confusion, constipation, and trouble urinating. Drowsiness and confusion can increase the risk of falling. If you are pregnant, this medication should only be used when clearly needed. It's important to discuss the risks and benefits with your doctor. Additionally, it is unknown if this drug passes into breast milk, so it's best to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when using oxybutynin chloride gel in packet. Some products that may interact with this medication include pramlintide and drugs that can irritate the esophagus/stomach, such as potassium tablets/capsules and oral bisphosphonates. Additionally, it's crucial to inform your doctor or pharmacist if you are using other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. It's also recommended to check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that can cause drowsiness, constipation, or blurred vision. Be sure to ask your pharmacist about using those products safely. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If this medication is swallowed, it can be harmful. If someone has taken too much and is experiencing serious symptoms like passing out or difficulty breathing, call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of overdose may include unusual excitement, agitation, fast or irregular heartbeat, and hot or flushed skin. If you have any concerns about taking this medication, be sure to consult with your healthcare provider. Always follow their recommended dosage and timing for taking this medication. Never share this medication with others. It is for your use only. Sharing it with others may cause harm. If you happen to forget a dose of oxybutynin chloride gel in packet, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. It's important to be consistent with your dosing to ensure the medication works effectively. When using oxybutynin chloride gel in packets, it's important to store them at room temperature, away from light and moisture. Avoid storing them in the bathroom or near an open flame, as this medication is flammable. It's crucial to refrain from smoking or being near an open flame until the gel has completely dried. Once used, make sure to throw out the gel packets in a secure trash can and do not save open packets for later use. And always remember to keep all medications away from children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. It's important to properly discard this product and it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.